Hello and welcome to the official YouTube channel of Lema Dental Clinic in Istanbul, Turkey. If you've been advised to undergo root canal infection surgery and are feeling uncertain about what the procedure entails, you've come to the right place. In today's video, we'll walk you through everything that happens during a root canal infection surgery from start to finish, so you feel confident and informed ahead of your treatment. So what is root canal infection surgery? Let's begin with the basics. Root canal infection surgery is a treatment used to remove an infection from a soft tissue inside your tooth, known as the pulp. When the pulp becomes infected, often due to the deep cavities, cracks, or trauma, it can lead to pain, swelling, and serious complications if left untreated. The goal of the surgery is to clean out the infection, save the tooth, and restore your oral health. Surgery consultation and preparation. Before the surgery begins, you'll have a consultation with your dentist during the visit. Your dentist will perform an examination and take x-rays to determine the extent of infection and plan your treatment. If root canal surgery is required, they'll explain the procedure in detail, answer the questions you have, and discuss preparations you need to make. On the day of the surgery, your dentist will review your medical history and make sure you're comfortable with the planned treatment. Local anesthesia and numbing. Once you're ready for the surgery, your dentist will administer local anesthesia to numb the affected area. This ensures that you're completely comfortable during your procedure and won't feel any pain. While you may feel some pressure or vibration, you shouldn't experience any discomfort. The anesthesia will numb the tooth, gums, and the surrounding areas to make sure the procedure is pain-free. Assessing the infection. After the area is numb, your dentist will begin by creating a small opening in the crown of your tooth. This allows them to access the pulp chamber where the infection is located. Using specialized instruments that your dentist will carefully remove the infected tissue and bacteria from inside the tooth. This step is crucial as it clears the infection and prepares the tooth for cleaning and sealing. Cleaning and disinfecting the root canals. Once the infected pulp is removed, the next step is cleaning and disinfecting the root canals. Your dentist will use small flexible instruments to clean out any remaining bacteria and debris from the canals. The canals are shaped to ensure that they can be properly sealed. This step is essential in eliminating any potential sources of infection and ensuring your tooth is fully sanitized. Sealing the tooth. After the canals are thoroughly cleaned and shaped, the next step is to fill and seal the tooth. The dentist will fill the cleaned root canal with a biocompatible material called the gutta percha, where helps prevent the future infections and reinforces the tooth structure. Once the canals are filled, the dentist will seal the opening with a temporary permanent filling. This step is important for protecting the tooth and preventing bacteria from re-entering the area. The final restoration. After the root canal infection surgery is complete, the final step is to restore the tooth's functionality. In many cases, the dental is placed over a treated tooth to restore the strength, shape, and appearances. The crown protects the tooth from further damage and ensures that they function properly when the bite and the chew. In your case, the crown may be placed immediately or after a follow-up appointment to ensure healing. Root canal infection surgery is an effective procedure to remove infection and save your tooth, preventing the need for tooth extraction. With the right care and follow-up treatment, your tooth can continue to function for many years. If you think you may need a root canal infection or surgery, you may have questions about the process, don't hesitate to contact us at Lema Dental Clinic. If you found this video helpful, please like, subscribe, and leave any comments or questions down below. Thank you for watching.